This session we'll be talking a lot about data. I am not a data person, but our first speaker, Donna Friedsam, very much is. She is the Health Policy Programs Director for the UW Institute for Research on Poverty, and she will be going into a lot of the trends related to ACA coverage and Medicaid coverage, a much deeper dive than we just had. And then we will transition to Matt Valiquette, who is the Program Operations Manager for the Bay Area Workforce Development Board. And he'll be talking about how to engage with kind of the current state of job loss and what that means for insurance and how we can partner with groups like his in the state. So two sides of one very important coin here. And we will go ahead and get started with Donna. Keep the questions coming in chat, and I will monitor and ask them when our speakers ask for them or at the end of each little section. All right, thanks, Donna. Take it away.
Good morning. Can you see my slides and me, or just my slides, or some version of both?
Both. We can see both. You're in the corner, slides are front and center.
Excellent. So things are working. So good to be here with you all and to see your faces or your initials in the boxes. I'm happy to be able to be back again to share a bunch of data and probably elaborating on a lot of the really important information that you heard from Nathan Hodek and Jim Jones already this morning. I think I'll be building on some of the things that they said, giving you maybe a little bit more detailed information. So for those of you who love getting more data and details, this is your session. And for those of you who find that boring, maybe get a cup of coffee. So let's get started talking about Wisconsin enrollment and coverage, what we're seeing in Medicaid and the ACA, trends and outlook for the plan year 2021. Let me put this in slideshow mode. Playing from the start. Okay, good. So, gosh, there's so many different mini windows open that are blocking my view here. Okay, so everybody knows that this has been a crazy year and because of the pandemic, because of COVID. And I just wanted to start out by setting the table with what's been going on in our state in terms of unemployment over the last several months. So you can see this. The map on the left shows what unemployment looked like in our state in January 2020. All of these maps using the same gradient scale. So on the left, most of the state was in the green, and if it had gone below green, there could have been gradients even well lower than 6%, showing significantly low unemployment rate, even 2.9% in Dane County, 4% in the 4%, 3%, 4% range in many of the counties in January. Then look what happened in April here. The entire state in the flaming red, well over 9%. Many counties in the double digits of unemployment, going toward 20% unemployment in some of the counties. So that happened after the state needed to shut down due to in March due to COVID. And so it's quite a dramatic difference. But then this is the most recent data that I was able to get. Whoops, let's not have that happen. Sorry. Okay. So then you can see here we are as of July 2020. So now we're already 2 months past that into the post major shutdown period, into the kind of bounce back in terms of the state opening up, not in terms of COVID numbers, of course, as we know, our state is very high in the pandemic, but in terms of opening up business, we've continued to open up. And even in July, it was dramatically more opened up. Many people went back to work as of July, and you can see that here. And if I have the numbers for September, and maybe the next speaker will be able to elaborate more on what they're seeing internally in the Department of Workforce Development. But we're going to see more people having returned to employment, even from July to September. And this is going to tell us something about what we're seeing in terms of the enrollment and health insurance coverage. Now, I'm just going to note that I seem to be having trouble advancing my slides. Okay. So in terms of Medicaid and Badger Care enrollment, now Jim Jones showed you one slide with the enrollment trends, and this slide just gives you a little bit more detail about that. You can see the month-to-month change from January through August of this year, and the top slide shows the month-to-month change overall in Badger Care, where there was very little change going on from month-to-month totals through March, but then in April there was an additional near 40,000 members over the previous month, and then so on each month thereafter. But like Jim noted, most of these people, seems like, are probably the people that were being held over because of the change in policy of not terminating or not conducting renewals. So we have yet to know how many of those people actually are new entrants due to the change in employment status, but it doesn't seem, given the picture I showed you on the previous slide, that we've had a lot of impact yet of people actually losing their coverage in this short period of time and needing to turn yet to their Badger Care coverage. Looking at the month-to-month change for the income groups for the eligibility groups specifically, you can see here that children and childless adults and parents and caretaker adults, they all significantly increased their numbers month to month, starting in April, and then slowly declining in the months later. And as well, income extensions, that group as well no longer has been no longer facing terminations at the end of their 12-month eligibility period. So they remain in the eligibility or enrollment totals that we're seeing month over month. So with that background, I'm going to come back to talking about Medicaid and Badger Care. I want to talk a little bit about what happened in ACA, the marketplace in for this current plan year, and what we can expect in the plan year going forward. Now, recognize that the data that we have for the current plan year that we're in 2020 are data from the open enrollment period that occurred last November 15th through December 15th, or whatever those dates, November 1st through December 15th of 2019, for people to sign up and get coverage in calendar year 2020. And we don't have, and all the figures that I'm showing you now are the figures that we received in the subsequent months from the federal government about what happened to those people in calendar year 2020. We don't have numbers about the special enrollment periods and the activity that has occurred since the pandemic for the ACA. And I'll say a few comments about that at the end, but I just want people to understand the degree to which people took up coverage in the marketplace for the calendar year apart from COVID. So in this calendar year, we had about 196,000 Wisconsin residents selecting health plans during that open enrollment period. And of those, 85% qualified for the premium tax credits and about 38% qualified for cost sharing reductions. And that financial assistance is quite substantial to allow people to afford the coverage that's available on the marketplace. You enrollment assisters know this well. The average premium statewide before the premium tax credit was $657. And after the premium tax credit, the average premium statewide is $173 per month. So that's quite a substantial change. And for those, and similarly, that's overall, including people who are not receiving federal assistance. If you only count the people that are receiving the APTC, the premium tax credit, the average premium for them before tax credit is $569 a month. And after their tax credits, their average premium per month is $107 per month. So those federal premium tax credits are really substantial and very important for allowing people to be able to afford this coverage. Now, you heard Nathan Hodak use the word effectuated. This refers to the idea that people who select plans may or may not actually pay their premium and actually start enrolling in their coverage by paying their premium. So who actually effectuated coverage for the plan year? People who paid their first month's premium and activated their coverage, and then continued to pay their premium and remain in coverage. Well, in Wisconsin, we actually do very well with that. In plan year 2020, 95% of the Wisconsin consumers who had selected an ACA marketplace plan during open enrollment went on to effectuate their coverage. So that resulted in 186,000 residents of our state that actually enrolled in their plans in February 2020, paying their required premiums and activating their coverage. So, and again, there of those people, 87% had federal premium tax credits, and 38% of them had cost sharing reductions. What happened over the last several years, and you all are well aware of this, we going back to 2014-15 and then forward to this trend, we started out at about 207,000 residents choosing health plans in the marketplace. It continued to rise over the next couple of years to a high of 243,000 residents. And then over the last couple of years, it has the number of people selecting health plans has on the ACA marketplace has declined. There's many factors that have contributed to this decline. One of them, as you all have experienced, is that the open enrollment period was reduced starting in 2017 from a 12-week open enrollment period to a 6-week open enrollment period. Similarly, there's a full pullback in federal resources supporting enrollment and outreach, but there's been a whole range of other factors about the market that have contributed to this pullback in or this reduction in QHP selections over the years. But who, in fact, has been reducing their enrollment in the marketplace? So if we had that 120,000, or if we had about that 200,000 people enrolling, it turns out, and I know this slide is pretty complicated to look at, but it turns out that if you look at this table, people can see. I just want to check with Adam. People can see my cursor here.
Yes, it staggers a little bit, but we can see it.
Okay, so the people with the lowest incomes who are getting who have available to them the most substantial amount of premium subsidy and cost sharing reductions are the ones who had the most amount of reduction in their health plan participation over the last between 2015 and 2020. So the people between 100% and 150% FPL, federal poverty level, declined 31% in the marketplace. And people between 150 and 200% of the federal poverty level declined 25%. And so these are these two lines here, where they had the most decline in participation in the marketplace. These other lines are these other members with incomes above 200% of the federal poverty level. They did not decline in their participation in the marketplace. And in fact, in some cases, they increased their participation in the marketplace. So look at 300 to 400% of the federal poverty level. So this notion that, and these are the people that have the much less federal subsidy available to them. And yet they're increasing their participation in the federal marketplace over these years. So this tells a number of different stories for us, but what we know is that it's this lowest income group that is having the most trouble connecting to the available coverage in the marketplace, and even this very low income group that might otherwise be eligible under a Medicaid expansion, but are in Wisconsin directed to find coverage under the Affordable Care Act, who are having the most trouble sustaining their coverage in the private marketplace here during this time period. People in this that have more income, but and are eligible for the ACA marketplace seem to be able to sustain and even increase their numbers in the marketplace. This graph shows the same thing pretty much. You can see what percentage the groups account for. Again, the lowest income range consumers account for a smaller proportion of marketplace consumers, while those in the higher incomes, and I'm using the word higher in a relative sense, consumers with incomes 300 to 400% of the federal poverty range have increased their participation in the marketplace the most. So some people wonder, well, have those people who are no longer participating in the marketplace, those lowest income consumers, maybe they're picking up Medicaid Badger Care. Well, it looks like the decline in the ACA marketplace enrollment by these lower income adults was not balanced out by any increases in Badger Care or in SSI Medicaid enrollment. You can see that in these charts, that enrollment remained flat. And the only time that the enrollment started to increase was at March 2020 with the at the point that we started facing the COVID pandemic. So what that would suggest is that those people in the lower income groups are not picking up their coverage, when they stop participating in the ACA marketplace, they're not picking up coverage by Medicaid and Badger Care, and there's a good chance they're becoming uninsured. And I'll show you some numbers about that in a few moments. So in terms of new consumers and re-enrollees in the marketplace, I'm just going to try to move this thing out of the way. Okay, so the proportion of re-enrollees, people coming back to the marketplace year over year, has increased steadily and substantially. So you can see that here, the orange part of the bar. Many of the re-enrollees rely on an active re-enrollment process. That's this blue part of the bar, rather than relying on automatic re-enrollment processes. And this reflects the need for them to every year reassess the available plans, the premiums, and the available subsidies every year. So that what that tells us is that people like you all, the enrollment assisters, continue to be essential, even not only for new entrants into the marketplace, but for the re-enrollment population who continue to need assistance in actively re-enrolling and reassessing their options in the marketplace. In terms of plan switching, we see that of those who re-enroll, 41% switched their plans in last year, and 59% remained in the same plan or in a crosswalked plan. And so going back, okay. So in terms of income, the plan selections by income level, you can see that the marketplace enrollments had plan selections by people across the income categories. About a fifth of them in this lowest income level, and so on. The metal level has changed quite a bit. So in this last year, 42% of enrollees were in the bronze level and 42% were in the silver level. And this has changed over the years. We used to see many more in the bronze level, and I'm sorry, in the silver level, and fewer in the other metal levels, because the silver level, as you all know, is attached to the cost sharing reductions. But what we see over the last year, is that the consumers who qualify for cost sharing reductions is declining. So remember in those previous slides that I showed you that the larger proportion of consumers in the marketplace are in those higher income brackets, the 300 to 400% FPL. You need to have an income of below 250% FPL to qualify for a cost sharing reduction. So fewer consumers are qualifying for a cost sharing reduction over the years. If you don't qualify for a cost sharing reduction, there's less of a reason to choose a silver level metal plan, because the silver level is where the cost sharing reductions are tied. So people are, and as well, and I'm not going to get into the details, but with the kinds of pricing changes that we had over the last year and what's called silver loading of the premiums, it has made the pricing of other metal levels a lot more attractive. So what we've seen is where we used to have most people choosing the silver level, now we have more consumers choosing the bronze level and getting near $0 premiums, and even more consumers choosing the gold level plans. In terms of plan selections by age, we have a significant proportion of our plan selections in that older pre-Medicare group, 55 to 64. And in terms of trying to balance this out with those younger, healthier people who will help our risk pool, this has continued to be a challenge for our state as it is nationally. Right now, about 22% of consumers who are selecting plans are in that age 18 to 34 age range. So those are these people here. And this shows the trend. This green group, ages 18 to 64, has increased as a proportion of the marketplace enrollees. So what we see here is that the proportion of marketplace enrollees in Wisconsin are becoming more and more this older pre-Medicare group, who are also more and more in that higher income level, less the very low income level groups, and we're getting fewer of the younger people as well. So I just want to alert you that we have my health policy group puts a number of maps on the web that you can look at, and we update them whenever new data become available. But if you want to look at your own county, you can go on the web at this website, and you can click on it, and it will give you the data specific to your county about the change in health in qualified health plan selections between 2019 and 2020, and it'll give you some other data as well specific to your county, like the statewide data I'm showing you here. So with all of that, knowing what's happened with the ACA and what is happening in Medicaid, I'm just going to give you a little bit of information about what's going on with the uninsured and who we all, and you all in particular as enrollment assisters, need to be looking out for and reaching out to in order to reduce our uninsured rate in our state, or at least not lose any of the gains that we've made. So the uninsured, what I do when I'm looking at how things change with the ACA is we look at 2013, which is the year before the ACA took effect. And then I look at the most current data available for today, which now is 2019 data were just released a couple of weeks ago for at the federal level. So we look at the data and look at before and after. And if we look there, we see that a substantial change, and we've seen this every year, where as of 2019, the state has about 5.7% of its residents uninsured, which is a decrease from 9.1% in 2013. But it needs to be noted that this is a steady increase from a low of 5.3% in 2016. Since before the ACA took effect, the ACA has been part of decreasing the state's uninsurance rate by about 200,000 people. Now, who is still uninsured here? Before I even talk about this slide, I'm going to have Adam put up the second of the polling questions.
Right, Mike, could you go ahead and load that?
No, okay, we'll do that. You can do this. No, the second one.
Yeah, Mike, if you could pull that and throw out the second one. I don't know how easy that is.
Okay, well, I'll just continue. We'll do both questions if you
Okay, we can do that.
Okay. So who is still uninsured in Wisconsin? And this is who we need to be paying attention to. Not, we need to be re-enrolling people who are currently enrolled to make sure they don't lose coverage. But in Wisconsin, as of 2019, and again, this doesn't account for what's going on under COVID, but the most recent data available through the end of last December show us that we had, for children make up about 15% of the remaining uninsured in our state, with about an estimated 50,000, 51,000 children in that age range remaining uninsured. I'm sorry, that should say 2019, not 2016. And so you can see that illustrated here. There's really no reason that 50,000 children should be uninsured in our state, because Wisconsin offers Badger Care coverage up to 300% of the federal poverty level for children. So that is a group that we really should be able to make substantial inroads in, and we need to get this number down. Similarly, if we look at the population overall here, we have about 325,000 uninsured residents in our state. Of them, 60,000 of them are below 100% of the federal poverty level. Well, in Wisconsin, Medicaid and Badger Care are supposed to be covering or offering coverage for every person, adult or child, under 100% of the federal poverty level. Some of these, of course, I recognize, are not eligible because of their immigration status, and that's a separate conversation. But most of these people in this group should somehow be able to be connected to Medicaid or Badger Care coverage and should not be uninsured. Similarly, this 97,000 here, which is 59,000, is a subset. I want to make sure you understand. So the additional 37,000 between 100 and 138 is the amount of people that would be covered under a Medicaid expansion, but regardless, they are the very lowest income that should be able to be covered with extremely high premium subsidies in the ACA marketplace. So somewhere between Badger Care and Medicaid and the ACA marketplace subsidies, we should be able to cover almost 100,000 people today. The rest of these people, the 173,000 people here have incomes between 138% of the federal poverty level and 400% of the federal poverty level. They would qualify for premium subsidies in the ACA marketplace. However, those subsidies are not quite as generous for those income groups. So it might be more difficult to get them to enroll in coverage. And then this group as well, they don't qualify for any financial assistance for enrollment. So of this total uninsured, however, we have about 100,000 that have substantial assistance available to them that we could really focus on getting insured today. And I just want to emphasize, 30% of all of the uninsured are people below 138% of the federal poverty level. More data resources here. I just put these here for when you have this slide deck available for you, so you can look this up. I'm not going to go into it. And then I want to refer you to this page. Nathan Hodick mentioned this, but when the plans become available in late October, which plans are going to become available in the marketplace for your county, this is where you'll find it. So you go to this website on the at the Office of Commissioner of Insurance, and you can click on and scroll down on this page, and you can find out which plans are offering in your counties for this coming plan year. So having emphasized that we have an opportunity to enroll people who today are eligible for substantial subsidies or Medicaid, I also want to amplify the message that Nathan sent in his talk, which is that we have really good news in that there's more plans participating in the marketplace in the coming year, and the overall rates, the premiums they're charging, separate from any kind of premium subsidy, continue to decline. So these, I just pulled off of the rate review website of healthcare of the federal marketplace a couple of days ago. These are the requested rate changes for all of the health plans that are going to be offering products in the federal exchange, and this is the amount of change they're suggesting or requesting from last year 2019, or from this year's plan 2020 to next year's plan 2021. And you can see mostly substantial reductions in the rates over this year, and some of them quite substantial. These are the range, because most of these health plans offer multiple products. So that's really good news in terms of affordability. So I just want to close by just mentioning a few things about what's happening at the federal level because of so much uncertainty. And this was mentioned when Nathan Hodak gave his talk, but yes, we're all awaiting this federal Supreme Court decision that will be, the case will be handled in November, Texas versus United States. With the change in Supreme Court justices, things are looking quite less certain about the future of the ACA, but we still need to, like we have every single year for several years, continue to operate with knowing that right now the ACA stands, and that no matter what happens in court, the plans for calendar year 2021 are in effect. And we need to just keep that message out there for people. All of the things that are happening in the courts will sort themselves out, but plan year 2021 remains as is. With regard to state work requirements, you heard Jim Jones talk about what's happening. There have been work requirements blocked in many states, Arkansas, Kentucky, Michigan, and New Hampshire. They are moving forward elsewhere. We have yet to know what will happen after the pandemic, the emergency orders, and what happens after the elections in November. Similarly, all these other matters about block grants, partial expansion is not going to be an option. It was turned down in Utah and seems to be not on the agenda for at least the near term. I believe you'll be discussing the public charge rule sometime during this conference regarding immigrant eligibility, but it's just going to be very important that you all have very clear communications with the public, with immigrants, about what their eligibility options are. And Adam can nod his head or shake his head about what forthcoming information is going to be in the conference, but these things continue to be litigated at the federal level, and we just need to keep our messages clear right now with consumers while others fight it out elsewhere. And then, of course, you all are well aware of the debates in the presidential campaign. You can hear more about that tonight if you can tolerate it. But there will be things about public option, about Medicare for all, about replacements for the ACA, and all other kinds of things that we all can just move on, put our heads down, and try to get people enrolled in Medicaid and the Affordable Care Act, because that's what we have available right now, and that's what is available for people for calendar 2021. So that's what I have to say.
But here's what we'll do. Thank you, Donna, so much. Well, Mike, throw both poll questions up one after another. And while that's happening, I'll ask a few questions. Oh, perfect. There they are. Awesome.
So this is like a post test.
Yeah, it's a post test of your understanding. So you know, Donna as an educator is very used to giving tests, I'm sure. One question I can answer right away: will we have access to the PowerPoint presentations? Our plan, and some of the pre-licensing folks already know this, is to get a message out at the end of each week that have the recordings and the materials, or let you know on our site where to find them. So you should have them towards the end of the week for reference, because I agree that with all the data, this one in particular, that would be nice to reference. Donna, do you know about how much, per the numbers you were talking about, of like uninsured children, like the rates changing in enrollment, could be attributed to immigration-related fear from parents and caretakers? And then what has been the increase in uninsured children since 2016?
So the number of uninsured children has been quite steady over the past several years. I have been putting up that same slide throughout the years, and it's always hovered around 51,000, 49,000, 50,000, 53,000. It's always been about the same number. It just seems like that last group is a very, it's a very hard margin to eliminate. And no, those are not 50,000 undocumented children. We know that. Now, certainly, it's very possible that some not inconsequential portion of them may be immigrant or maybe citizen children of undocumented parents, and that creates a barrier. I would imagine, to their connecting to public benefits, and especially with this public charge rule going on. But I do not know what proportion of that 50,000 falls into that range. I will say that it is unlikely to be the majority of that group.
Great. Question here. I'm going to try to clarify it a little bit. Can you just talk real quick when the context for the rate change? The insurance plan submit those. Is that to OCI, or how does that work? Can you give a little more context?
So the rates are the rates that the rates that I showed you are the health plans need to submit rates to the federal marketplace and to OCI for them to review to see if their requested rate change is reasonable according to various guidelines that they have and that they need to live by. And then the rates get approved or reviewed, and they ask to give different justifications if they want to, particularly if they want to increase their rates more than a certain amount, which is not the case in Wisconsin right now. So so those are the proposed rate changes, and it's likely, if it goes like other years, that the proposed rate changes are the rate changes that we will end up seeing. And then and those will be the plans that you'll see populated on healthcare.gov in late October.
Okay, thank you. That looks like it helped. Do we have an idea what percentages are for the calculation of the APTC rates went down, but the consumer, will the consumer see it? That might be a little in the weeds, Don. I don't know if you want to talk about that, or there was a question that came in earlier also about silver loading. If you kind of want to talk about that process at all.
I'm happy to talk about silver loading if people want to hear it. But can you just say the first question?
Yeah, it's do we have an idea what the percentages are for the calculation of APTC? Rates went down, but will the consumer actually see that? So it kind of, I mean, in some ways it depends on what plan they're picking, and that's why I referred it over to silver loading.
Yeah, we have some very sophisticated listeners on the line. So the APTC is pegged to the second lowest cost silver plan, and the percentage of the income that the premium would require at different levels of income. And so people who are getting an APTC, in the same way that they're shielded from large increases in premiums, they're also shielded, for better or for worse, from large decreases in premiums. They are what they experience is stability in premiums, as long as they are selecting something close to the second lowest cost silver plan. But what it does is it creates a situation where others who do not have the benefit of large APTCs are more likely to be able to afford coverage on the marketplace. And similarly, those people who don't have any option for premium subsidy have more likelihood of being able to afford coverage on the marketplace.
Great. Let's we do have a couple more questions. One may get covered in Matt's section here, which is coming up. I do want to just jump over to the polling before I switch it over to Matt. Don, I don't know if you're able to see the polling tab on the right-hand side there. It looks like for the first question, I don't know if I can see the whole question, but I think it's the because of COVID. Most people said false, 135 people said false. And then for the second one, there was more of a split, but more people said false than true. Would you go ahead and tell us what the answers are?
So the answer is false for the first one, that it is that the rates will not be going up because of COVID. The rates look like they're going down. And there's a lot of things that go into rates, but one of them is likely that the significant decrease in healthcare use that was experienced under the pandemic. However, like both Jim and Nathan pointed out, healthcare use is likely to rebound at some point. And then, so I just want to flag that to say that we are benefiting right now from this reduction in rates. But it is likely that at some point rates will pick back up when people start using their healthcare again. But we'll take the benefit when we can, and that's what we're seeing right now. The second question, there was I had asked about people for their understanding of which proportion of the uninsured are in different income groups, and it is. I'm trying to think how I set up the true false there. It is not correct that. Well, let me just say it this way. The answer is that most of the uninsured are it's split somewhat evenly, where about 38%, about 30% of the uninsured are in that very lowest income group, the below 138% of the federal poverty level, and slightly under half of all of the uninsured are in the total lowest income groups, and then about 172,000 of the uninsured are above the 200% of the federal poverty level. So I understand why this is a split answer, because it's not entirely clear who's the lowest income and who's not. And I expected that to be a little bit confusing. But the main takeaway from this is that there are a lot of people who are very low income and would qualify for large amounts of federal premium subsidy who remain uninsured. And similarly, would, if it happens, which does not seem likely, but if it were to happen that we had a Medicaid expansion, there's quite a large number of people in that uninsured category who would become insured under that coverage as well. And then about half of those people who are currently uninsured are in that category who will benefit from the declining premiums, because they are more exposed to the fuller cost of premiums in the marketplace.
Great. Thank you, Donna. Thank you for sharing all of your knowledge and data with us. I do think that it is greatly beneficial for people to have that perspective. Like I said, I'm not a data person, so it's always helpful to have somebody else break it down. And yes, we will be getting the slides out to folks. We're gonna switch it over to Matt to talk a little bit more about the on the ground stuff, what this looks like, what the job losses look like, what the loss of insurances look like, what we could do, how we can partner. And then hopefully turn it into a conversation for the end. I'm going to give a brief applause for Donna, because you guys, even when you can't see me, I applaud for all of our speakers. But let's go ahead and give it over to Matt. Take it away.
All right. Thank you, Adam. Hopefully you can hear me well.
Yep.
All right. Excellent. All right. That's a pretty impressive presentation to have to follow. So well done, Donna. Hopefully I can carry my end of this presentation. With that, again, my name is Matt Valiquette. I'm currently the Program Operations Manager with the Bay Area Workforce Development Board. I'll talk a little bit more about the role that workforce boards have in the state of Wisconsin, and then invite your input and thoughts on how we may better collaborate and strengthen that partnership as we work with folks that are likely to lose their jobs permanently or are already in a state of unemployment. So I'll get to that in a little bit. But let me start off with two caveats, two quick ones. One, I'm likely the only non-healthcare expert asked to present at today's conference. So hopefully you'll bear with me, and we'll kind of go from there. So, and the other caveat is that for those of you that were super excited to see 10 or 20 slides in this PowerPoint, I'm only going to use a single PowerPoint today. So Adam, if you could put that up at any point, I'd appreciate that. And as I talk, I'll keep my comments short for a couple of different reasons, and most notably the fact that I'm not an expert. You guys are. So hopefully I can stimulate a little bit of a discussion at the end of this presentation and invite your thoughts and input as to, again, how we can better partner and get that information to folks that need it most. And that certainly is something that was very compelling in the evidence and the data that Donna provided, is that there are a lot of folks in the state of Wisconsin that could certainly benefit, whether they don't know the information or how to access the information. One of the roles the workforce boards play is just that, is getting the resources and that useful information to folks that need it the most. So with that, so I've got two real purposes here today for my participation. First is to create a greater awareness of the roles that workforce boards play. There's 11 workforce boards across the state of Wisconsin. We all look very similar, but there are still some regional differences, and that's really by design. So at the end of this presentation, I will provide my contact information to Adam. And if anyone is interested, if you're from different parts of the state outside of Northeast Wisconsin, where I'm based, then I'm happy to connect you to my counterpart. And if you're not already connected, kind of going back to some of Donna's comments earlier, there's tens of thousands of people, hundreds of thousands of individuals that could certainly benefit from your services. And we work with a lot of those folks, as I'm going to make clear here in a little bit. So, and then lastly is, again, I ask for your input along the way. If you have any questions as far as what we do, how we do it, and how we may do it better. Things are changing rapidly. If the pandemic has taught workforce boards anything, is that we have a lot of ground to make up. And we need to harness technology in a more effective manner in order to reach the folks that are in most need of these services. So again, I'll touch on that in a little bit as well. So again, let me start with providing just a brief overview of what workforce development boards do. We operate a number of different programs, all of which are designed to help our customers obtain meaningful employment, earning a family-sustaining wage in a high-demand driver industry. And for the purposes of, in my area of jurisdiction, which is the 11 counties of Northeast Wisconsin, I guess I should have said that earlier, which is Florence County to the north, Sheboygan County to the south, Shawano, Menominee counties to the west, and Door and Kewaunee counties to the east, and everything in between. So it's very diverse geography, which has a lot of micro regions and a lot of just diverse characteristics that we have to tailor our programming and services to. And most of the workforce boards across the state of Wisconsin operate similarly. So with that, it's primarily funded through the Federal Workforce Innovation Opportunity Act. And not entirely funded, but primarily. There are three primary programs, one of which is aimed to helping at-risk youth. As much as I hate that term at-risk youth, it's still a federal term. Generally characterizes a young person between the ages of 14 and 24 that have one or more barriers to education or employment, ranging from homeless, runaway foster, basic skills deficient to reading and math skills are below 9th grade level, high school dropouts, pregnant and parenting, involved in the juvenile justice system, things along those lines. We have an adult program, would be the second primary tier program, and that's really geared towards any adult that is likely living below the federal poverty line. And there's some very basic eligibility requirements associated with the adult program. And the third program, and the one in which I'm really going to spend a little bit more time talking about today, which I think is most relevant to this particular conference, and maybe there's some opportunities there for your direct involvement, is the dislocated worker program. So we work with thousands and thousands of people every year that face permanent job loss through no fault of their own through our dislocated worker program. And we call that a rapid response. And so in my area, I facilitate and choreograph the entire operation. Generally, we'll talk to the workers as well as their families at a point prior to their date of layoff, so that we can ensure that that transition is as seamless as possible. It never is seamless, obviously. And anybody who has lost anything, whether it's a loved one, a relationship, or a job, even a job they don't particularly care for, go through the normal stages of grief. And so we have to deal and understand and empathize with all of the feelings that one might have. And those initial feelings oftentimes are accompanied with just denial or disbelief. And that leads to inaction, which inevitably will lead to financial disruption and all other kind of stressors that we attempt to alleviate by working with these families before they're ever laid off. And so where we coordinate and with all of our efforts with both the employer, if the union is involved, and then obviously the impacted workers. So again, that's tens of thousands of people across the state of Wisconsin that fit that category. I'll talk a little bit more about the specifics as it relates to COVID, but surprisingly, what one might think the impact that COVID has had in terms of permanent layoffs in the state of Wisconsin is very counterintuitive. So I'll share a little bit of data here in a second. So, all right, let me take a breath and we'll go on. So again, as I said, there's 11 workforce boards across the state of Wisconsin. All of them operate all of these programs, albeit somewhat differently. But let me spend a little bit of time talking about the dislocated worker program and why healthcare has just been a continuing increase in both importance and relevance. This is pre-COVID as well. And I think the characteristics of a, if there's such a thing as a typical laid off worker in the state of Wisconsin, may make it a little more clear why healthcare continues to grow in importance. I will tell you this, when I started this job 10 years ago, healthcare was pretty much a peripheral type topic of discussion. Generally, when one faces, as my PowerPoint slide shows, there's a couple of the bubbles there that are of most and greatest concern to somebody that is facing layoff. At the top of that list is unemployment insurance, and we've certainly witnessed and observed the fiasco that has certainly about in the state of Wisconsin. Wisconsin's not alone, but it has most recently resulted in the forced resignation of the Secretary of the Department of Workforce Development. He inherited an obsolete system that unfortunately impacted folks in some of the most financial hardship ways, and that's very unfortunate. And I have not seen anything where I sit that has indicated that there's any real movement towards progress in the world of unemployment insurance in the state of Wisconsin. Hopefully that gets addressed. Not being a state worker, I can say that and get away with it. And I've certainly said it publicly in the past. So that's one of those major components that, again, somebody that is facing long-term unemployment is how do I file for claims? And so we go in with a team, again, of subject matter experts, and we address unemployment. We go in, again, one of our subject matter experts comes from higher education. The Workforce Innovation Opportunity Act that we operate provides a significant amount of funding for individuals who are interested in furthering their education. And that's going to be really important with another piece of data I'm going to share in a second. Other community resources through United Way or other, every community has certain resources, and we bring those folks in too to help folks understand what's available. Well, even if they're not ready to access, most and those that have been in the workforce the longest generally are the most ill prepared to look for work. There's an art and a science, and that changes rapidly. And so we also bring folks from our American Job Centers to come in to help with resume development and interviewing. But the bubble at the bottom, and that's really what this conference is all about and why I was asked to present here today, is healthcare. And so in the past, generally, we would provide a basic overview of things like COBRA, and there's always a sticker price shock when dislocated workers determined or found out, discovered how much that they would have to pay following layoff of the employer's portion of that. Well, of course, we would talk about Badger Care, and then we would talk a little bit about the Affordable Care Act and the different ways to access information. Very confusing, very complex. I've been fortunate to have a number of healthcare experts like yourselves come in and collaborate with our group and add a tremendous amount of value. Julia Garvey is one of those individuals in the Fox Valley who has accompanied my team on a number of those rapid response sessions and has always added tremendous value. And those folks that were sitting in the room left far more informed and better prepared, begin navigating some of the complexities of healthcare post layoff. And again, it started before they were ever laid off. So with that being said, let me talk a little bit. The only pieces of data I intended to share today was the COVID related. So Donna already presented the unemployment insurance, and you can't take away too much of that stuff. Yes, pre-COVID, the state of Wisconsin was right around 3.5% across the board. Some areas were a little bit higher, some areas are a little lower. I think Donna's information showcased that. You know, at the height of COVID, we were looking at about a 20% or so unemployment rate in much of the state of Wisconsin. Currently, we're sitting at, I might be a little bit better than you or have certain connections, Donna, but I was able to get the August unemployment figures, and we're right at about a 6.0% across the state of Wisconsin. Experts will warn you to not draw too much from that. Yes, it appears as though more folks are back to work, which is an obvious truth, but of those that aren't, or those that have just stopped looking for work, you know, there's a much deeper discussion there, and there's plenty of evidence that would suggest that the businesses that have somehow managed to operate for this 6-month period of time during this pandemic are not likely to be able to continue to operate for much longer without significant impact to the size of the workforce or permanent closures altogether. I think in the state of Wisconsin right now, there's a recent report that indicates roughly 1/3 of all restaurants will be closed before the end of the calendar year. I don't say that as a doom and gloom type thing, but I would just, again, caution folks when you take a look at the unemployment rates and as they continue to increase, do not draw too much from that. So the data I want to suggest or provide here today is delving a little bit deeper into the demographics of those that are currently unemployed due to COVID. And remarkably, the overwhelmingly number of new claimants for unemployment insurance have been women, particularly women between the ages of 25 and 35. And that's not unique to women. That same age category was also shared by men, but also for those women over the age of 55. Now that makes sense in my world, considering that the service sector has been the hardest hit due to COVID. Now, if you go back and look at the Great Recession and look at 2010 and some of the demographics and the characteristics associated with those that were most impacted during that period of time, it was predominantly men in the manufacturing sector. You know, so what does that then mean moving forward? Well, I think it could mean a lot of things. I don't think anybody has the answer, certainly not those of us in workforce development. But the fact that you have individuals over the age of 55, which is not significant in terms of the demographic itself, because that has been a very standard characteristic associated with most of the major layoffs, certainly in Northeast Wisconsin. So it goes back to that comment I made earlier about healthcare becoming a preeminent concern with those that are facing permanent layoff. And this is where again, I invite your feedback and your direct input because you are the subject matter experts. How can we improve that collaboration, strengthen that partnership to ensure those that are impacted and have healthcare coverage concerns have the information and resources readily available? So I don't know if there's any questions at that point, Adam, about anything I've shared.
There's one that I think is pretty good, or a pair of questions that are pretty good right here. You may or may not know. So have there been any conversations regarding improvement or an overhaul of the how to file for UIB says unemployment insurance benefit system? So that's question one. If you're aware of any kind of improvement, or I mean, it's kind of a DWD question, Division of Workforce Development, but any plans to improve or overhaul the application for unemployment?
No real plan, and not in terms of an actionable plan. This has been a topic that's been discussed probably, and certainly throughout my 10 years here. No one with whether they're part of the Department of Workforce Development or someone like myself working for a private nonprofit workforce board, which all the workforce boards are nonprofit agencies. None of us were surprised that the Wisconsin unemployment insurance system was completely overwhelmed at the early stages of the pandemic. They're operating on a 1980s something piece of technology. I suspect that the new secretary, once nominated, will make that a #1 priority, and you'll see that plan rolled out within the next year or so.
Very cool. The follow-up on that, and this is the answer is going to be, community by community, but is when would job centers be opening up again to the community? And I believe, opening up in an in-person capacity is what I assume that means.
Yeah, that's a great question, Adam, and that certainly is one that we have certainly discussed here in our region. In our 11 counties, we have 9 different job centers. Not all of them have the same level of services, but all of them are able to connect folks to the full complement and range of services. There are a number of job centers that are open in the state of Wisconsin. None of them in Northeast Wisconsin. They're open on an appointment basis. There's one in Milwaukee, and there's one in Wisconsin Rapids due to a major paper mill closure there. So to answer the question, the short answer is there is no reintegration reopening plan at the moment. Department of Workforce Development has made that perfectly clear. It certainly is one being discussed. Now, from where I sit, I will share with the audience that we've been spending really the last better part of the 6 months planning for a contingency where job centers don't reopen, and identifying ways in which we can provide the same level of service to the greatest extent possible in a primarily a virtual environment. Some of which we're currently doing. But if this is going to be something that we're going to do indefinitely or develop a model around, it's certainly something that continues to evolve, and we'll see where it goes.
I got a question that came in, and again, this may or may not be something you're aware of, and I know you mentioned your work with Julia Garvey, but how is Workforce Development Board and job centers utilizing enrollment assisters to help with open enrollment, or I would say help in general based on the status of things as you described it?
Yeah, I can only speak for what we're doing here in the Northeast part of Wisconsin, and that's it's more of providing the information and the resources, some of which folks like Julia have provided me. In some of our counties, through the county health and human service departments, there's a healthcare navigator that we've enlisted their support, particularly working with dislocated workers and their families. But if it's a one-on-one or a customer that happens to access our services either virtually or pre-COVID physically coming into our job centers, and then we'll have a full range of information. And I'm not afraid to say that we need to do better. That's not good enough. Years ago, we didn't consider healthcare as a primary component of the workforce development solution. Hindsight's 2020, but for anyone who thinks that it isn't today, knowing what we know now is foolish. And so we have taken some major strides in being more comprehensive in terms of looking at workforce development as a comprehensive, holistic, wraparound continuum of services, and healthcare is going to be, it needs to be at the forefront.
Great. I'll say in other areas as well, we work on rapid response, we work with DWD and then other partners in areas to identify where these closings are happening and where layoffs are happening, and to get healthcare information in front of them and how to connect those dislocated workers to assisters like us and like you guys. So one more thing, and then I think we do have to wrap up. I believe we're a little over time, but that's totally fine because I think this information is awesome and these questions are really good. This was just a point from one of our attendees, is that any agency that is doing, I think that's reemployment services assistance, should have information about referring dislocated workers to assisters for help, which is true because we do try to make those partnerships in the communities where we are and where we're trying to identify those people. Okay, Allison did say we do have until 12. Okay, that is more than I thought, which is excellent. So keep the questions coming. And then, Matt, any further thoughts on either rapid response or anything new that has any undertakings that have worked in terms of identifying these populations or connecting them to assisters?
Yeah, that's a great question, Adam. And let me just kind of expound something I might have said earlier, or I think I said earlier, maybe I wasn't perfectly clear. So our rapid response team, generally, if it's a mass layoff or a business closure, it triggers what's called a WARN notice. And that's just a federal requirement. We've seen surprisingly a small number of WARN notices here in Northeast Wisconsin since the mid-March timeframe. And that really gets the ball in motion. And once that company, and oftentimes the company will contact me before a WARN notice is even issued to ensure that they're meeting the federal requirements, and I'll help walk them through that. And that's a tremendous benefit and value to those impacted workers, because then that allows the system of services that we lead begin to be applied. All of those individuals, even if their layoff is delayed or maybe it doesn't even happen, they're still eligible for everything that we can provide. And so to get that information to them in a timely manner is critical. And that's where, again, I would invite, the audience, for those of you that have never heard of this process before or have never been involved in a rapid response, or you don't know who your workforce development board partners are, then I would ask you to contact Adam. I'm happy to share that information, because I know for certain that our workforce development boards would very much appreciate and value your direct input, as I do.
Sorry about that. My mute fidgeted a little bit there. So one point that came through, which I think is a really good one as well, is to highlight the success of the drive-through job fairs. Matt, that may be something you're familiar with. Otherwise, I can talk about the ones that just happened on September 17th.
Yeah, it's I don't want to sound critical, because I think the effort is very much appreciated. And let me say this: I mean, the employers are desperate, certainly in Northeast Wisconsin, for skilled workers that want to be working. And so one of the roles that a workforce board plays is making those connections between the employers that are looking to hire and those individuals looking for work. But there's a whole nother cohort of individuals that are also unhappily employed or underemployed. We refer to them as the Alice population, because they're oftentimes fully employed and yet their income is severely constrained. And so we're looking at really adapting and evolving our own system of services so that those individuals can also take advantage of some of the programs I highlighted earlier. And oftentimes those individuals that are working underemployed are either underinsured or fall into Donna's category of not being insured at all. So again, there's another group of folks there that we also need to be considering. I don't know if I answered your drive-through job fair. I mean, the numbers were I would be impressed by the numbers in terms of employers or individuals seeking those services, but I think the advertising probably wasn't what it could or should have been. I think there's more effective means to connect with employers that are looking for skilled talent than going through a job fair. That's my own personal opinion.
I will say this, and this goes for all of our speakers. Please be critical. That's what people pay for. That's what they want to hear is the real stuff. So just to follow up on what you just said, then what would be a more effective strategy in your opinion?
Well, one, we have to, as a workforce board, we have to understand who our customer is. And certainly Julia and others have heard me say this: if we try to be everything to everyone, we'll be no one to nothing. So I know that's a double negative. So, but I say it with that caveat. So it's very challenging. And I think we have to best understand the needs and make the services not just available, but accessible. And I think too often we expect somebody to come into one of our job centers Monday through Friday, 9 to 5, and oftentimes they're working. Same is true, and we've challenged our colleges and universities in our area and to innovate the ways in which they deliver curriculum in high demand driver industries. You can't expect somebody to commit to a 2-year training program, but yet still has to put food on the table and support their family. So delivering curriculum outside the normal Monday through Friday school hours is something that more and more schools are doing, and we certainly applaud their efforts. No easy answers here at all.
Yeah, for sure. Here's a question that just came in that is something I certainly haven't thought of. Maybe you guys have. How much of a role or connection do you all, so I'm assuming workforce development boards and your partners, do in terms of childcare providers and to make sure that parents seeking employment have adequate and safe childcare options?
That's a great question. Thank you for whoever submitted that. So one of the great attributes and strengths of the Workforce Innovation Opportunity Act, the three programs, the youth, the adult, and the dislocated worker program, provides wraparound services to include supportive services. And so they're all based on an objective assessment of unmet need. And now I'm getting a little bit in the weeds of what it is we do in terms of programs and service delivery. But if an individual has childcare requirements and cannot go to work or cannot go to school because of that, we provide the funding to meet that unmet need. And that goes for mortgage assist or rent assistance, energy assistance, utility bills, transportation assistance, you name it. And so in a given 12-month period, we'll spend a little over $500,000 just on supportive services and supportive and tuition assistance.
Great. Yeah.
And let me say one last thing here, just while I'm talking about workforce boards, and it's not just the technical skill sets that we're looking to help develop with our customers. It's the soft skills as well. And we hear from our employers all of the time that yes, they're a great welder or they're a great nurse, but I can't get them to come to work. And so we need to make sure that they're ready to excel when they get to the workplace, not just with the technical side, but with all the other things that an employer would need a qualified employee to have. So it really is, it takes a long time. And when you're working with buried individuals, many of them came from a lifetime of poverty and dysfunction and chaos and trauma. And if anybody understands the impact that ACEs have, adverse childhood experiences has on one's cognitive development, they understand it takes a long time to work with those individuals to help them understand there's a different way to operate. And so that's our customer.
Yeah, absolutely. Hopefully you can still hear me. My computer is essentially frozen. I can hear everything just fine, which is good. And hopefully people can hear me.
Yep, we can hear you, Adam.
That would be really helpful. Otherwise, we got a couple minutes left. Or Matt.
No, I have nothing more to add. I appreciate having me on today. Hopefully, I provided some information of value and relevance, and I look forward to partnering.
I think certainly this is an incredible context, and I hope more people build meaningful partnerships with boards like yours and for having this year. So thank you very much, Matt.
Thank you.
And yes, thank you so much, Matt and Donna and Adam. This was really, really excellent information. I learned so much. I think it was so valuable, as always, to hear Donna just share this really deeper understanding of just what's happening with the uninsured in our state. Who are they? Really, where can we be focusing our efforts? And then for Matt to really do this deeper dive into what's happening in our state right now with unemployment and really how we might best connect with those groups that are located where, and just especially on the healthcare side of that, how we can collaborate. So thank you so much, both of you. I really value having you here. And for everybody in attendance today, thank you. This is the close of today. We will see you again tomorrow. And before we close out, just a reminder that at the end of the week, we'll be sending out an evaluation. And just a heads up, we are planning to do a separate supplemental office hours session with one of our navigators. It will most likely be Adam, and perhaps another, separate for those of you who really want more of a meeting space to ask questions that are more in depth than what we can cover in each of these sessions. So more information coming soon about that. But otherwise, thank you again, and we will see everybody again tomorrow. Take care. Bye.